back. Okay, now remember, I'm out here on a ranch, and sometimes when it clouds up, we get it drops the Wi-Fi. So I'm back, and I hope you're still here. I pray that you're still here. Medical Potpourri, and I was talking about seeking the Lord first. And so hopefully we'll keep it. I saw it clouded up. Sometimes when it gets stormy here, I'm out in a little town of 1,700 people. I'm way out of town even. Yeah, and sometimes our Wi-Fi drops. I think they're working on getting a better and better connection. I want to pray, Father, I pray you'd give us your mind. Lord, help my connection to stay. I've really prepared. I prepared all day for this. I ask, Lord, that you'd bless the time. Give me your mind, Lord. You said you could have the mind of Christ. I pray that you'd bless each person that's listening and let someone who I need to help be out there. In Jesus' name, amen. Okay, so one of the most important things you need to do is pray about where you're going to go for help. I'm going to talk about 4 interesting case studies that I don't even know if I'll get to all 4 of them, but one of the most interesting case studies I have is about a man who came into, I was working for Dr. Streeter, and he came in with a sore throat and a cough. Now, one thing the DOs do, and Dr. Streeter did, was if you complained of a sore throat or of you get a cough, you immediately had to get a throat swab. Now, how many times have you gone to a doctor and they might take your blood, they might show you have an infection, but you really don't know what's in your throat or what's in your nose or what's going on? And so, but they give you an antibiotic and you go home and, okay, so we don't know if you got well. You might have gotten well, but you might have not treated the real thing, and it might have buried in your body. And remember, those of you that did not see my last video, you need to go back and watch the 5 invaders, because those are the things that make us sick. And I'm going to be talking about those off and on. I don't know what I'm going to do next week, but I'm going to talk about Lyme. I'm going to talk about cancer. So many things that I know that I've studied and learned about. So this man comes into the office, big, tall guy, and found out he was in chiropractic school, and he had this horrible cough, and we had a waiting room full of people. I don't know, probably 40 people, and he was hacking like the kind of cough you want to sit as far away from as possible. You know, terrible cough. So I took him, I asked him, I said, why don't you come back here and sit in the back room? And of course, we got a throat swab, and a throat swab was $15 back then. This was in the 90s. And so I had told the lady in the lab, we had a lab lady, I said, if you ever see anything unusual on the microscope, call me back. And so she called me back. She said, Carol, you need to get back here and see what's in this man's throat. And so I said, oh, I'm coming right back. So I went right back there, and I looked on the microscope, and here was it looked like a round jelly-like amoeba, a round jelly-like thing, and it had a tail. Well, it was a protozoa, and a protozoa is a parasite that lives in moist environments. Well, I went and talked to this man, and I said, what have you been doing? And he said, I replaced a toilet this weekend, and I was, I took the whole toilet out, and I was in the hole, and then I put the toilet in. And I was like, wow. Well, he had a protozoa, which meant he needed a specific antifungal. He had to have anti-parasite drug, because penicillin wouldn't have killed it, and amoxicillin wouldn't have killed it, and Z-Pak wouldn't have killed it. He needed an anti-parasitic. I don't remember exactly what we gave him, but we gave it to him, and he came back in a week, and he said after one day on the medicine, the cough completely stopped. You want to look up, I'll put one on later, but I looked them up today, and they're quite interesting, and there's lots of different kinds. His had a tail, so those are the protozoa flagell. My point here is that we got to get the facts. So many times you go to a doctor or you go someplace for care and you don't get the facts. Now, and your bloods do not always show what's wrong. You can have labs done, and that doesn't always show until, okay, yes, if you're sick and you're full of cancer and you have it and you've had it for several years and you've maybe ignored some symptoms, then your test might show it. But you want to find out beforehand. And since heart is the number 1 killer and cancer is the number 2 killer, I want to address both of those in my upcoming videos about how to fight those with diet and exercise. So my first point in that principle, in that case, is always get the facts. And you're not going to have that unless you get to a functional medicine doctor, a DO, a wellness clinic, a naturopathic doctor. I keep stressing that. I love the phone calls I'm getting. And by the way, if I haven't answered you, just private message me again. I'm catching up. I was on the phone today with a young man that I gave the advice to get a scan, and he, after 7 years of frustration, he finally found out what was wrong with him. But it was through a biomeridian scan. And so anyway, he found, I talked to him and I was really rejoicing, and I was able to give him some help. But there are many, many, many problems now that traditional doctors do not have this. They don't have the skills, they don't have the tests to diagnose. It's not their fault. Again, we need them. We need surgeries, like if you break a hip. We need stitches if you have a cut. We need an orthopedic if you've got a fracture. But for things like lupus and stomach problems and even cancer, there's so many diseases out there, and I guess I want to say chronic illnesses that there's no real help for. And yes, diet is important. Yes, you are what you eat. And I believe you can heal yourself a lot with food and juice. But you also may need a healthcare professional. My husband and I are under the care of a healthcare professional. We are doing some cleansing for parasites, but we're doing it under the care of a healthcare professional. She is I have a naturopathic doctor. I have a nurse practitioner who does biomeridian scans. Second case history is my husband, Richard Tudor. He meets me at the door one night in 2004. We had been married 5 years, and he's pointing to his, he meets me at the door. It's evening. I'm in my pajamas. He just comes home from work, and he's pointing to his ribs, and he says, "I'm in terrible pain," just very calmly. And my husband I think because of heavy metal toxicity from the from the Air Force, I think he has a high pain tolerance. He doesn't always know when he's in pain. So this was unusual that he told me. I said, "You're in pain," like he wasn't coming up the stairs, like we need to go, and he said the ER. And I'm like, oh, and I knew then it was something bad. Well, we got into the ER, and they took an x-ray, fever, temperature. They said he had pneumonia. They gave him an antibiotic. We came home. And in 2004, we didn't know. I don't know what we were doing. We weren't doing as much natural medicine as we are now. But we came home. We took the medicine. He got worse. And one night he was coughing in the middle of the night. Horrible. Blood pressure went up to 200 over 130. And I said back to the ER. He didn't want to go to the ER because he didn't want to pay money. I said, we have no choice. Something is not working here. So we went back to the ER, and we got in there. I'll never forget the lady Italian doctor who ripped our lips off. She basically yelled at us and lectured that we waited too long, and now he's going to have to be in the hospital because he has pneumonia. And so they stuck us in the hospital, and I will stop here and say right now, do not return to doctors who yell at you. You know, doctors and nurses, they're good people. They're great people, and I believe nurses are really heroines of the profession. We do a lot of dirty work, and we don't get paid near as much as doctors do. And I respect the sisterhood greatly. I love it. I love the nursing profession. I love taking care of people. I care about sick people. I'm very interested in diagnosing and finding out. I want to help that person find out what's going on. And so, do not return to a doctor who chews you out. I have a friend who's a heart patient, and his doctor yells at him. He's already stressed because he's a heart patient. I said, don't go back to him. I would never go back to a doctor who chews me out or spits me out. Now you know what I think. Back to Richard Tudor. We're in the hospital. We're in Crown Point, Indiana, little town, small hospital. He's on IVs for antibiotics. And he's not getting any better, he's not getting any worse. So it just so happens on the weekend, a very unusual doctor, because he was anxious to find out things, was on call. He wasn't normally at this hospital. He came in to see Richard, and he decided to pull out the stops. He called in all kinds of emergency people, and he did a thoracentesis. And what that is they stick a needle in the middle of your back, in the right spot, to see what's in the lung. Now, mind you, my husband was not spitting up blood. He was not spitting up anything. And he was taking treatments, but he had this pain in his lower left side, and so they thought it was pneumonia. Well, they couldn't really see it. And so When they stuck the needle in my husband's back, I was standing behind him, and they had a large glass bottle, like the size of a liter bottle, and out of the needle came pure blood. And of course I was horrified. And I tried to put my nursing face on. And this doctor said, now, you know, he looked at it, and a whole bunch, I mean, half the bottle got filled up with blood. But my husband's not spitting up blood, so where was this blood coming from? So we go out of the room, and I'm like really concerned, and he goes, now Carol, it may not be cancer. Sometimes funguses look like cancer. And so I planted that in my brain, and we're like, what are we going to do? This is a Saturday. This doctor was only on call for the weekend. We were praying, should we go to Mayo Clinic? Now, that's when you want to get a second opinion, if you can, is before you get cut on, and before you are, you know, because here's the thing, you want a doctor who's done a lot of surgeries. You don't want somebody who's done 20 of something. You want somebody who's done 1,000 of them. And you're going to get that at major medical centers. And again, not an elective surgery. Try not to have surgeries. I try not to go to any doctors. I try to look up to figure out what I'm doing wrong, and I try to go to functional medicine people who, what they do is they try to find out the why behind everything before they even treat you. So, Richard Tudor's in the hospital. It's now been 4 or 5 days. We come down to Monday, and the older doctor, sorry for saying that, but he was older and he had a long gray beard, did not inspire any confidence in me. He comes in and says he wants to do exploratory surgery on Richard. Exploratory. In 2004, you just want to cut somebody open and go looking? You can't do that, because if you do an exploratory, you don't know where you're headed. You don't know, you could have a lot of extra bleeding. Okay, so right away we said, we had asked God, give us the signal when we would need to go to Mayo. So that day we started hustling, and at that point, it was before the Affordable Care Act, so things were a little bit easier about getting into places. My very good friends, some of my very good friends from the school and lifelong friends got in a van and drove me and Kathy Wilkie, my husband, and a car following so they could go home, and we went up to Mayo. We got there about 1 o'clock in the morning, and we had totally forgotten, but 15 years before this, Richard had no, to take that back, not that long, 5 years before that, he had a biopsy on a cyst in one of his lungs. We didn't remember it. And so the doctor, Perlero, #1 Italian lung doctor in the world, we were so blessed, and that's why you go to these major medical centers to get somebody who's highly recommended. He came in and he asked Richard about it. Richard said, I don't remember. And he said, well, we don't know what it is. But at Mayo, they had the technology, which Crown Point didn't have, and that's why you go get a second opinion when you're under the pressure for something like this. I mean, this wasn't going to be fixed by vitamins, folks. You know, people who think I don't believe in doctors. I mean, this is not something that was going to have. This was an emergency situation, and we had to find out what was going on. Well, blood was circulating around Richard's lung. It was in the lining of his lung. And so I saw, and they had a thing called VAPS, Video Assisted Pulmonary. They were able to put a little camera in between Richard's ribs and see into that lung and know right where to go. So after surgery, the doctor comes up to me, Dr. Perlero, and he says, with his hand just like this, like tiny little, this much, he said, I've seen this many of these in my 40-year practice. And he said, I believe it's a fungal cyst. And he said, it's very uncommon. And he said, maybe I've seen 1,000 in 40 years compared to lung cancer. And so, and he didn't have to take the whole lobe out. He only took that area that was cistular. Well, the nurse practitioner came in the next day and she said, Dr. Perlero never goes to the lab to look at tissue. He just trusts the labs. And, you know, they do a thing called a frozen section. When you're on the table, they actually take a tissue and run it down to the lab to see what it is, because if it's cancer, they do more extensive type surgery sometimes. And so they knew that it was a fungus, but she said Dr. Perlero went all the way down to the pathology lab to look at it for himself to make sure it wasn't cancer. Now, 3 things I want you to learn from this, and one is you always want, if you're going to get a second opinion because you've got something traumatic going on, if you're able to. Sometimes you're not able to, but if you're able to, you want to get it at at a major medical center. And when I lived in Crown Point, Indiana, it was either go to Chicago. I happened to have some friends up at Mayo. That's why I went up there. I had an inn up there. I had been there myself. Mrs. Evans had been there, so we knew to go up there and we knew we could get in, and we did. We got right in. And secondly, you want to go someplace that has more technology. Some of the larger medical centers have research grants that give them money to get them all this equipment that these small hospitals don't have. Believe it or not, back in Podunk, Indiana, they're still doing some surgeries that are like 20 years old. They're still doing protocols. You're not supposed to, when a woman has cancer, they're not supposed to take out all those lymph nodes out of the armpit, but they do it. So a lot of these small towns, a lot of these smaller hospitals are going to be behind. They're not keeping up with the research. Or they don't have the finances to buy the equipment, the scanning machines, the x-ray machines, the video assisted, all the equipment that, of course, someplace like Mayo Clinic has. I'm not telling you to go to Mayo Clinic. I'm telling you, if you do have something, you would want to go someplace, a major medical center where you're at, close within your in your boundaries. And so then, my husband did extremely well. He had a morphine pump. They immediately started the day after surgery with a morphine pump. My husband walked down the hallway to therapy. And this is why you go to a special place when you have things like this, because they wouldn't do that at home. And number one, they don't control your pain very well. Number two, they don't start therapy right away. And the therapist told me, unless we control his pain, he will not be exercising. And he was doing bands, and he had a very large incision. For those of you that know anything about medicine, a thoracotomy is actually harder on the body than open heart. Open heart, they just break the breastbone. On a thoracotomy, you have to break ribs. It's a slash that starts in the front and goes all the way around the back. They have to go through the ribs, and they have to have a chest tube, which is bubbling in air till his lung reinflates. All of this to say, a fungal cyst. How did he get a fungal cyst? Those are caused by parasites and too much antibiotics that cause fungus in the body. Did not know that in '04. I know that now, but I did not know it in '04. And it's very important that you get the facts about what's going on. Short story, simple concept. Doctors treating you with respect. Good friend has to have a physical. She's very overweight. Very pretty lady. Tall lady, but big. And probably 50 pounds overweight. She goes to doctor because she needs a physical in order to take a college class. And when she does, he walks up and he grabs her stomach and says, "What are we going to do about this?" And that's the kind of problem we have with doctors who can be arrogant, can be critical. And my friend never wanted to ever go back to a doctor. And she didn't. I don't blame her. Now, yes, are we sensitive? Yes.